So, for the first question, to discuss two things directly from the article that I can start doing today to help close the gap between my worth and value, I would say it would be to understand our services and that they are not for free. The article goes on to say that we need to take a stand on the importance of service and the value the AT brings to consumers. We need to respect our knowledge and our educational certifications. As an athletic training student, I think this stand and way of thinking can be started today, because if I start to understand that our license and our credentials means so much more, it will be easier to sell people that we are healthcare professionals. Like, that certification just isn't a certification. Like, we are healthcare professionals. Like, we do have the education and knowledge. And that will help me when I am actually licensed. Our value increases with a license, but some people don't realize we are licensed and our services shouldn't be handed out for free. The second would be to understand that we are not just doing coverage. All of us students, we always say, like, yeah, I'm covering football. But I think if we stop using that word so much, then we can understand that our more than what our services and more than what our ATs provide. I think if I begin to stop using the word coverage, that can also add value to AT. When I'm interviewed, like for a job, I think I shouldn't use that word, and I should rather use like our 5 domains and like injury prevention, medical referral, and practice and competition management, like the article talks about. Talk about those 5 domains and what we actually do, because we're not covering. Like, we do so much more than just coverage. So that's like the assumption of what we do. The next question is to discuss 2 ideas from the article that you feel you can implement as a certified athletic trainer to close the gap between your worth and your value. So I see myself working in the college setting at a smaller university. I would eventually like to go into education and eventually research. That has always intrigued me ever since I took research and exercise physiology. But one idea I see myself being able to implement is to provide CPR, first aid, and AED training. This was one of the things on the list, and as for the basic, or for the best practices, and this would increase our value, because then, like, a high school athletic director wouldn't have to bring in like an outside source or something, and that could really like increase our value as well. The second best practice I would be able to implement is the care coordinator and the best referrals. Since we've had our gen med rotations, we were able to learn a lot at the offsite locations, including like the dentist and the eye doctor, and so being able to refer when those referrals are needed. And then we can also use our education and refer for like counseling, or even just counseling for us, like in areas like nutrition, can also increase our value. And so I think these 2 areas, sometimes we don't always see that broader picture, but those would be able to increase our value, especially in the high school setting when they might not have counseling services like the college setting, or those CPR and first aid training for like the staff at a high school. So being able to provide those services can always increase our value.